when somebody comes into our dental office and says that they're a big baby or they're really, really scared, we just say, well, we have a word for that. And they look at us with a fearful complexion, like, well, what would that be? And I say, normal. Normal, normal, normal. That's a normal response to going to the dentist. What I've been doing for most of my career is trying to make that not such a big deal. It used to be that if somebody was really, really fearful, that the only thing you could do would be to send them to one of the rare dentists that specializes in doing all the work with intravenous sedation. And while that is a very good alternative, I believe it has a few more risks, and it also is much more expensive. We have availability in our office to actually call in a specially trained doctor that will do the sedation for us in our own office while we do the work that's needed, and there is no need to go someplace else. But we have found that we don't need to do that too much because we've developed some methodology that helps most people have dentistry done without having to go into intravenous sedation or even general anesthesia for that matter. The first level, softening the blow, so to speak, would be using nitrous oxide conscious sedation, and that is basically breathing a sedative gas through the nose. That was once called laughing gas because if you're up on that too much, you're probably going to laugh. We don't want people to be up on it that much, but at a particular level, you're sort of mellow. It could feel different for one person to another. Most people, we say it's either going to be like you had a little bit of wine or even perhaps a couple beers. And the neat thing about it is you breathe it through a nose mask, which fits loosely on your face, and you don't care as much about what's going on. You don't lose consciousness. You still can talk to us and everything. If that works well for somebody, if they're having some cleaning procedures done around gums that are inflamed or sensitive, we can just squirt some gum anesthetic liquid on the gums and just go right ahead and do what we have to do. If it's having some dentistry done, whether it be fillings or other procedures, we have very specially prepared, potent topical anesthetic, which we call pre-numbing, that we can put on the tissue before we administer the local. And we have an attachment which is called a vibroject, and what that does is it vibrates a lot. And so when you have the pre-anesthetic, and when you have the nitrous oxide being administered, and when you have the vibroject, you could very often give local anesthesia, still by injection, but it's given in a manner that a great number of people will literally ask me if it's been done the first time, well, did I get the shot yet? And very often they've already had 2 or 3 injections and they didn't even really feel it. You could go to the next level where you might have somebody that needs a little bit more help than that, in which case we can administer a oral medication, usually about 90 minutes before they come in. And at that point, the patient would have to be driven in and driven home after it's done. When they come here, they're usually in a pretty good place. They're usually pretty happy, actually, believe it or not. And then we get them in our treatment room and we give them a little nitrous oxide as well. And these people are almost on the verge of sleeping, but not. They're just in a really good place. And we do all the other things that we said earlier that we do, and we can quite often get them through the procedure to such an extent that for subsequent visits, we've had people say, you know what, could you reduce the medication that I took before I came in? I don't think I need as much of that now. We actually can have people wean themselves off the oral medication and just rely on the nitrous oxide gas and local anesthesia, which again, that would mean they can just drive themselves in, get the work done, and then drive themselves home. They'll still be a little numb from the local anesthetic. We see little kids, we usually just give them the nitrous. We have big screen TVs in all of our rooms. We can offer them headphones. So when you have a kid that's watching Nickelodeon or Disney and they've got headphones on and nitrous oxide, they're so tuned out that, you know, you can pretty much do whatever you need to do, including the oral injections. And Parents are absolutely amazed when they see the kid just talk and laugh through the whole thing. And our whole goal is just to get the treatment done as comfortably as possible